Good evening. There is a new and troubling development tonight in the recruitment of trained medical specialists to work in BC hospitals. Right now, one of the biggest problems is a shortage of the doctors who deliver anesthesia. That shortage so acute at the hospital in Cranbrook that it has resulted in major surgery delays. To help ease the burden, the hospital has managed to recruit a new anesthesiologist. But the department head has resigned over that hiring, saying the new recruit is unqualified.
Are you starting to feel the medication much? Not too much? Okay. Tough guy. All right. We got lots.
If you were about to go under the knife, wouldn't you want to be sure that the person monitoring your vital signs and administering the drugs to keep you under knew what he or she was doing? New allegations tonight that the Cranbrook Hospital is so desperate to find anesthesiologists, it has recently hired someone who is not qualified anywhere in the world to do that specific work. The hospital is using a clause that allows it to do this as long as the new recruit is supervised. That decision led to the anesthesiologist department head to resign 2 weeks ago.
The term of supervision, the entity of supervision, is a very broadly defined, practically non-specific, non-specified. I'm very uncomfortable with the fact that it doesn't entail supervision by another anesthesiologist.
In accepting her resignation, the hospital's chief of staff wrote back praising her for much of her work, but also saying, in order to ensure the recruitment efforts were successful and the facility had 24/7 coverage, we had no choice but to bypass the normal departmental processes. The biggest risk to patient safety at this time is 24/7 coverage, which you and Dr. Neiman have hindered with your actions.
There are rules and procedures in place, and they should be being followed. It's not good enough to use as an excuse we have to have somebody because somebody is better than nobody. Those rules and procedures are there for a reason. And the fact that we're seeing, skirting taking place is unacceptable.
The Interior Health Region says the recent hiring of a non-anesthesiologist is totally legitimate in BC, and this person had extensive training.
If we were concerned, I can tell you, credentialing in Interior Health is extremely vigorous. We follow the medical staff bylaws very, very carefully. And if we were concerned about this physician's credentials, he would not be coming.
Interior Health says there are possibly hundreds of doctors who've not quite met every criteria to work in BC, but have been given provisional licenses because they're qualified in other ways. Without these provisional licenses, it says the province couldn't run half its hospitals. But what concerns Cranbrook's recently resigned head of anesthesiology is that bringing in unqualified people for a position as key as this can be very dangerous, even if they're, quote, supervised.
Are we waiting for an accident to happen before supervision is being defined? I'm at a loss for that, to define that more specifically.